Okay, Assalamualaikum. Thank you so much, Dr. Zurin, for the kind introduction. I'm trying to figure out how to put on the slide first, but yes, thank you for the kind introduction by Dr. Zurin. So can you see the slide? Yes. Dr. Zurin? Okay. I think all of the participants had a very busy day today. There were like four speakers already ongoing. So thank you so much for bearing with me. This is the last lecture for today. I will play some videos to just break the monotony of lectures to help you all with that. So okay. So there's some technical difficulty. Let me just sort this out. I'll be back with you in a few minutes. Thank you. I'm not in the slideshow. Yes. Okay, thank you very much. Let me start with my lecture. So I'm talking today about clinical trials and randomization. I noticed one of you were asking about how to randomize during clinical trials. So don't worry, we'll go through it shortly. Okay. Now, the outline of my lecture is such, where I will try to talk about, we'll talk about clinical trial basics and purpose, the history of clinical trial a bit, because I love history. So when you know history, then you will understand why certain things are put in certain ways. So and then we go to clinical trial phases, and then I will touch on randomization. There'll be a video to describe about randomization as well, and what are the challenges. I'll touch a bit on the challenges of having clinical trial in the pandemic era. So let me bore you a bit with history, but I know some of you are interested with history. So the history of clinical trial are very interesting. So it starts off way back when during the Greek era, where there's one person called Herophilus, who began to use scientific inquiry in medicine, and he used dissection. He recognized that the brain is a center of nervous system. He started to describe about arteries and veins and about pulsation, and that's where I think the basis of Chinese medicine, where they describe diseases by just feeling the pulse. So then the world of medicine opened up so much more with Avicenna. As we know, Avicenna is also known in the Muslim world as Ibn Sina. So it is what Avicenna did was it kind of like make a revolution in terms of medicine and clinical research. So the first documented description of medicine and health was by Ibn Sina, and his famous book Qanun fi Tibb, or Canon of Medicine, that was 1,000 years ago. So he introduced into experimentation into medicine and the idea of clinical trial. And what he did was mainly describe in his books about tuberculosis and also the disease, the new disease that was described by him. It's not new, but it was newly described by him, which is diabetes mellitus, as we are all concerned now. So the principles of clinical trial by Ibn Sina opens up the world of clinical research. So these are some statements, important statements from his book that has become fundamentals of clinical research. So the first one is the drug must be free from any extraneous accidental quality, meaning that you should be very sure with whether the treatment is going to be effective to treat the disease. So you should try and avoid anything by avoiding bias, like what Dr. Isanaina just mentioned just now, making sure that all things are done properly to make sure that this is not just an accidental result. Number two, it must be used on a simple, not a composite disease. There was, during that time, there was no understanding about confounders yet. So, but by now, we know that a certain disease may exist with others. But the statement where he kind of like recognized that you must make sure that you study only one disease and also account into other diseases at the same time to make sure that you don't make a mistake about your result or your assumption. Okay, we move down to number 3 there. So number 3 says that you must be tested by 2 contrary types of diseases. So this is where you have randomization. So meaning that you have to have groups of studies so that you can actually make the correct assumption on that particular group that you are studying. Number 4 is that the quality of drug must be corresponding to the strength of the disease. For example, there are drugs whose heat is less than the coldness of certain diseases, so that they would have no effect on them. So you must be able to tell whether you apply a certain amount of medication that will result to that certain effect that you require. So the principles of dosage is there. Okay, so you can understand that he talks about dose. So number 7 is the time of action must be observed so that the essence and accident are not confused. So this is about follow-up. So having assessment and follow-up, different timeline to assess your output is very important. Okay, next is the effect of drug must be seen to occur constantly, or in many cases, for if this not to happen, it was an accidental effect. So the fact about having an analysis well done is already outlined here. So meaning that you have to have the importance of a clinical, well documented data analysis to make sure that the effect is seen. And number 9, the last one, which is a very important statement, the principles of clinical trial by haslina, is the experimentation must be done with the human body. Why? Why? Because you know that if you test it in rabbits, and if you test it in monkeys, or even if you test it in a horse, the effect might not be the same as how you test it in a human, because our system, our mechanism, our drug processing, and our pharmacokinetics are different than them. So that's why he said that to translate the result into human, the test must be done in human. So that's how clinical trial comes about. Okay, so unfortunately, as the time progressed, this clinical trial principles was not really expanded much until Edward Jenner in 1749 in the US first tested the method to protect against smallpox, where he did an observation and he found that midwives didn't get smallpox despite severe outbreak. And they only killed them, which already killed almost 20% of people affected. But why? Because his milk makes have cowpox. So he kind of like have an idea that maybe we can try and see whether this cowpox can actually protect those who are being inoculated from getting smallpox. So he did that, and he was one of the most famous talked about clinical trial that was done then. However, there are people who rebuff this. They say that actually the first device, it was first devised in Turkey and brought to Europe by the wife of English ambassador to Istanbul in 1724. So yeah, there are some a little bit different version of it. But the clinical trials as of in 1800, they just base it on making an observation, developing an hypothesis, and to try your idea on a person. Okay, there's no essence of informed consent yet, on ethical, on how to properly do it without causing harm. So these are the things that develop much later. So as time goes on, there's another trial that was done in history by an army doctor, Walter Reed, which studied about the yellow fever. So he was asking whether was yellow fever transmitted by fomites or a live vector. He wanted to know the cause of the disease. So he put his workers into 2 different buildings. One is infested with fomites, and there's another one who actually have a live vector, which is rats. So then rats and mosquitoes and everything. So he developed the first informed consent that if anybody, any of the patient developed yellow fever, they will be compensated with additional $100 on top of the $100 that was given if the person agree to be recruited in the study. So, but from here we can see that the development of a compensation or informed consent and the volunteerism, the agreement of the patient to participate is there now. So as the time goes on, somehow during there was a dark time for clinical research where the research is non-regulated. It was non-ethical, non-consented, and it was seen in huge amount during the World War I, where we see these clinical trials, the clinical research, so-called clinical trials, done on the prisoners of war in the Nazi camps. And there were also unethical placebo group, and where there are also maltreatment in clinical research. So with this evolution, we know that as medical person ourselves, we know about Hippocratic Oath. The first thing is do no harm, right? And then as the time developed, looking at the essential of the need of having a clinical trial with a done proper way, and from the World War I inhuman execution of clinical trial, there come a code which is very much remembered as the Nuremberg Code. Okay? So from this on, if any one of you is going to attend a good clinical practice course, this is a must know. So all of this history and all the outline of the ethical code are important for you to understand. So they come after that, one after another, the Universal Declaration of Human Rights, Declaration of Helsinki, and as you know, the Declaration is Helsinki and the Hippocratic Oath are the most common ethical principles that you must mention in your proposal. Okay, so if you make your proposal, for example, things that actually your proposal is about clinical research, so these two statements must be these two code adalah benda yang one of the most common mentioned in your proposal. Okay, so as time goes on, FDA was initially initiated in the Food and Drug Association Agency in US, was formed initially as only a scientific institution, and then developed into a law enforcement organization that oversee the ethics of clinical trials and the passing of certain drugs for the consumption of human. So this is the Hippocratic Oath, and the first thing, as we say, is I swear to do no harm. So these are the Nuremberg Code and Declaration of Helsinki. You can see that there's some similarity that actually started with the clinical trial principles by Ibn Sina. Some of it actually stems from there. So then I think that's the end of my history of clinical trial. So now you understand why we have this certain way of doing clinical trial to make sure all the things that we mentioned just now, the ethical, the human treatment, the informed consent, the proper organization of subjects to make sure that they are not being treated inhumanly or unethically is important. So let's come back to reality. So what is the clinical trial basics and purpose? So as you know, clinical research is a fundamental of evidence. So now we talk about evidence-based medicine. I'm sure all of you has been briefed on why we have to have evidence-based to practice our medicine. So clinical research is one of the important foundation of good and safe clinical practice. So what's the difference? Why some people say clinical research and why some people say clinical trial? Well, basically, clinical research is a medical research that involves human. It can be divided into observational studies, or it can be divided into a clinical trial. So clinical trial, when people mention about clinical trial, usually it is referred to testing of drugs or testing of intervention on humans to see the effectiveness. For example, if you test a certain vaccine, for example, so for example, our COVID-19 vaccine, all the clinical trials, when you say clinical trials, it's all the things that is needed to make sure that the vaccine is effective and safe for us to use. So observational study usually basically observe people in normal settings and specific environment. For example, prospective or retrospective, and usually they are non-interventional. It helps identify new possibilities for clinical trials. So researchers gather information and compare changes over time. So these are the fact that anything that actually studies about diseases, about human, are called observational studies. And example is they collect data through medical exams, medical records, and which can be also mentioned as a retrospective study where they look at medical records and exams. And they also do tests or even questionnaires about a certain group of people, a target population, to learn more about the disease, the effect of different lifestyle, or on cognitive health. Then we talk about clinical trials. Okay, back to clinical trials. So clinical trials are research studies that are performed on subjects or humans that are aimed at evaluating medical, surgical, or behavioral intervention. So the goals of clinical trial are one, to explore new therapies, either it's a medication or a type of intervention, to make sure that the aim is to prove the new therapy is safe and also effective. Number two is to improve outcomes. So for example, if a tested intervention or drugs is more effective than the standard, we want to prove that. So that's why clinical trial is also important in here. Number three, the purpose is to reduce harm. So it's such that if an example, a treatment at the moment is causing some form of harm or side effect, so we want to know whether this new drug can cause less harm, at least less harm, even in spite it being a similar effect on the previous drug. So other objectives that you can think about is about clinical trials is to find the cause of disease early. So sometimes because what we are talking now is more like prevention. So the medical world now are moving from just treatment to preventing. So clinical trials can actually achieve that by looking at whether a certain type of intervention or drugs might prevent a disease. And also test ways to prevent health problems. And also the objectives of clinical trial is whether it can make the life better for people living with a certain life-threatening disease, or whether patients have some health comorbidities that might actually lead to another problem. So number four is whether the study of the role of caregivers or support groups have any effect on the outcome of the disease. So not only we are studying about drugs, we are also studying about intervention, be it social intervention, psychological intervention, or whatever type of intervention to actually achieve improvement of the outcome of disease and maybe to treat the disease. So when we talk about clinical research, we have to understand there are many types of clinical research, as I explained just now briefly here and there. So the first one is called treatment research, which involves interventions such as medication, psychotherapy, new devices, or new approaches to surgery or radiation therapy. Okay, so another one is prevention research. So as the name goes, we are trying to see whether the type of intervention that we give are able to prevent the disorders from developing or returning or relapsing. So different kinds of prevention research may study some other medicines, either any certain medicine, vitamins, vaccines, or minerals, or any lifestyle changes that can achieve this prevention. Next one is diagnostic research. So the clinical research now is not only trying to cure disease, but it can also be something to see whether now we can detect disease earlier, and refers to the practice of looking for better ways to identify a particular disease or condition. So the screening research aims to find the best ways to detect certain disorders or health conditions. I think it's the same as the diagnostic one, but screening is more broad. So maybe we are trying to aim whether it is quite sensitive or not to detect diseases, but to make it specific, then it comes into diagnostic research. So sensitivity is more to screening research, specificity is more to diagnostic research. So next one is the quality of life research. So this is a lot of things being done at the moment. Most of the time, the quality of life research is based on questionnaires. So they might give questionnaires to the patient. They might also follow the patient up from the very beginning of life. There was a big study, I think there are many big studies at the moment in the world that are still following up their subjects. One is actually a twin studies done in the UK. There's also a happiness study done in Harvard, and there's also a life quality of life or life extension study, which looks at how can a person live longer and what are the factors affecting the livelihood or the life expansion, life expectancy of a person. So you can look at the results in TED study, TED talk, a lot of TED talk on YouTube. They talk about the result of these researches. And then we have genetic studies, okay? So genetic studies are fairly new. It is aimed to improve the prediction of disorders by identifying and understanding how genes and illnesses may be related. So a lot of difficult diseases that are inherited are being looked at using these genetic studies. So this research is trying to explore the many ways of a person's genes that cause the disease and how to manipulate these genes so that it doesn't manifest into a disease. And these may lead to development of tailor-made treatments based on a patient's genetic makeup. Okay, so I think one of the nearest one that I think I understand was for eye, there was a study on retinitis pigmentosa. So how to prevent a person who's born with gene that can cause blindness due to retinitis pigmentosa, how to adjust it so that the retinal pigment epithelium doesn't die as how a normal person without P gene develop blindness. So the last one is the epidemiological study. So epidemiological study is quite vast. We can see in many fields. So we seek to identify the patterns, the cause, and what are the control of disorders in the group of people. So you can see that there are a lot of clinical research, very many types of clinical research, but our focus today is more on clinical trial. But I think it's not fair to just jump into clinical trial without understanding what are the type of clinical research that we can do. I'm trying, so today I'm going to play to you an example of an epidemiological interventional study done in Pakistan looking at a certain disease by UNICEF. Okay, so let me play the video for you and you can pick up points.
This video covers randomized controlled trials, or RCTs, which are one option to consider when planning an impact evaluation. Before deciding to use RCTs, you will need to consider the building blocks of evaluation, research design, data collection and analysis and synthesis.
How do we do?
RCTs measure the impact of an intervention on a particular outcome by conducting a carefully controlled experiment to compare at least two groups, one which has received the intervention and one which hasn't, known as the control group. For example, UNICEF recently funded a trial of early child development intervention in Pakistan. The trial aimed to intervention and one which hasn't, known as the control group. For example, UNICEF recently funded a trial of early child development intervention in Pakistan. The trial aimed to evaluate the effectiveness of early childhood interventions to strengthen and improve the health outcomes of young children. Hundreds of children were randomly selected at birth from a number of rural catchment areas to be part of the RCT experiment for a period of 24 months. The selected children were then randomly assigned to either the intervention groups or the control group. The process of random assignment to create these groups is a key feature of an RCT. Without it, it wouldn't be an RCT. In a simple RCT, a single intervention group is compared with a control group. The results of the evaluation are determined by comparing the progress of the intervention group against the control group. More complicated RCTs can have more than one intervention group. In the Pakistan example, there were 3 intervention groups, each receiving a different set of treatments. The first intervention group received nutrition counselling, responsive feeding advice, and nutrition supplements from 6 to 24 months of age. The second intervention group received stimulation and care for development advice, including coached practice, integrated in routine monthly home visits and group meetings. And the third intervention group received a combination of both the early childhood development and the enhanced nutrition interventions. They were all compared to each other, and also the control group, which had no new intervention. This design, in which a third intervention group receives both interventions whilst the other 2 only receive one, is called a factorial design. The inclusion of this third group allows us to study the individual effect of all the interventions as well as their interaction with others. A factorial design can have a number of groups and variables and is not limited to the combination shown in our example. In this RCT, the children were sampled as individuals, but sometimes participants are randomly sampled as groups, for example by school or village. This is called a cluster RCT. Back to our example from Pakistan. The children's development was monitored against several different measures at different points until the children were 24 months of age. This study found that at 12 months of age, all 3 intervention groups had significantly greater cognitive, language, motor and social emotional scores as compared with the control group. This continued to be the case at 24 months of age. Based on the results from this RCT, further action can then be taken to improve the developmental outcomes of other children in similar circumstances. Randomized controlled trials are not always the best method of evaluation. There are times when RCTs are more appropriate, and others when they would not be as effective or may not be possible. For an RCT to be appropriate, there must be a large enough sample size to work with. A small sample size increases the risk of coming to the wrong conclusion. RCTs are applicable when the intended impacts of the program or policy can be readily agreed and measured, such as reductions in stunting or improvements in language development. They are not suitable when the intended impacts are varied, emergent, and hard to measure, such as the difficulty of measuring all types of violence against children in a country. An RCT needs to be carefully planned from before the beginning of an intervention. RCTs cannot be undertaken retrospectively. Because data need to be gathered from the beginning of the program or policy until impacts can be observed, RCTs are usually not suitable when quick answers are needed. Another situation when RCTs are not suitable is when the number of units of analysis is too low. For example, capacity building in a single organisation or advocacy campaigns at the national policy level. The low number of units won't allow random assignment and tests of statistical difference. Other evaluation methods will have to be considered. Random assignment makes it likely that the groups will be equivalent, but it cannot guarantee it. Simple assignment can sometimes result in groups with an unbalanced spread of characteristics, such as gender, ethnicity, or age. There are things we can do to help ensure the treatment and control groups are similar, such as using stratified sampling, where you purposefully separate out a sample into strata based on a characteristic of interest, for example, different age groups. You can then randomly assign each stratum at a time using a forced equal group size to make sure that the groups are evenly distributed. However, there is always a danger that there may be unobserved differences between groups which influence the results of the evaluation rather than the intervention. For example, differences in education attainment. Another way groups can become unbalanced is through attrition, individuals dropping out of the study. For example, a program might work for some people and not for others. If the participants who are not getting good results drop out and are not followed up, their data will not be included, and the program will look more successful than it really is. Contamination is another cause of misleading results. Imagine an evaluation where the results show that the control group has the same results as the treatment group. It is likely that people will conclude that the program was ineffective. But what if individuals in the control group had actually received the intervention? What if they managed to access the treatment through other means, such as another program funded by another donor? The program might be highly effective, but the RCT would not show that. To guard against this, it is important to gather data on the treatments and services received by the control group and not to assume that they have not received any. An ethical issue sometimes raised about RCTs is whether it is fair that one group will receive an intervention which may improve their lives, while another will not. However, an RCT is only done when there is not sufficient knowledge about whether or not an intervention is beneficial. In some cases, it is possible to commit to rolling out the program to everyone if it is found to be beneficial. Another ethical issue that must be addressed in RCTs, as in any evaluation, is the issue of informed consent. Participants must be adequately informed about the potential risks and benefits to them, and not coerced or deceived into participating. It is also essential to have protocols in place to stop the trial if there are early signs of harm. Results from RCT should be used carefully to inform future decisions. Just because an intervention was found to be effective in one context doesn't necessarily mean it can be scaled up effectively or transferred to another context. You also need to consider other issues when using the results of an RCT, such as whether there are sufficient funds to scale up, any equity issues that need to be addressed, and whether contextual factors will limit the feasibility or effectiveness of the program in a new situation. You can find out more about research methodologies from the other videos and briefs.
Okay, so now we understand
of early child development of early child development intervention of early child development intervention.
So how can I do this?
Of early child development intervention impact.
Sorry for the technical. So this one.
Development intervention in Pakistan. The development intervention in Pakistan. The trial aimed to evaluate the in Pakistan. The trial aimed to evaluate the effectiveness of early childhood interventions to strengthen.
Okay. So you can understand, sorry, while we settle up the technical problem. So you can understand from the video that the type of clinical trial that was done in Pakistan. So they actually looked into more to epidemiological and interventional and looking at the well-being of child development, and looking at the role of all the intervention that was mentioned there. One of the important elements about clinical trial here that you can actually almost listen throughout the lecture. The video was about randomization. So there are certain things that you must abide to when we talk about clinical trial. You must talk about randomization, on how to select your sample and how to group it so that you do not cross-contaminate the issues that was mentioned just now. You are not exposing your sample into a lot of confounders. So it starts off with having a good proposal. So for you to embark on a clinical trial, having a good proposal, as what we mentioned to you from day one of the course, is very important. So it's all intertwined. And what was mentioned by Dr. Isanaina in previous lecture about biases in your study are also very important. So as a researcher, you have to have a proper research group. Your senior lecturer has to be there. The appropriate people or the group of researcher has to actually give inputs based on their experience on what are the probable confounders, biases, or issues related to the clinical trial. So clinical trial, in a way, is not easy, but it's doable. But however, you have to think into all of the elements. So the next thing is for us to look into clinical trial. So what are the clinical trial phases that we can understand about? So when we talk about clinical trial phases, usually we talk about treatment. So testing a treatment, testing a product, testing a medication towards the effectiveness of the disease. So clinical trials is designed to evaluate and to test new intervention, as we mentioned previously in the previous slide. So usually it is done in 4 phases. What we commonly talk about is 1, 2, 3, where this is the requirement, basic requirement of phases before a drug is being approved for consumption in human. So the trials at each phase have a different purpose, and it helps scientists answer different questions. So one of the main body that regulates drug approval and testing is the FDA in the US. They require phase 1 and 3 to be completed. Only when they get the results, the drug or intervention will be approved for use. So the highest hierarchy of clinical trial is something called double-blinded control trial. So I will talk about double-blinded control trial after this. Let's just go through the phases of clinical trial. Okay. So the clinical trial process, as I mentioned just now, is not simple. It's not straightforward. We have to have a good protocol to make sure that the protocol is being looked at all angles. So this protocol is going to go through screening by the ethics committee, and the investigator selection is very important to make sure that we get a 360-degree view on the execution, the possible problems and issues related to the trial that we are trying to do. So, and also we need the approval process. So once we go on, once we have a good protocol and everything is looked at for the proposal, so we go through protocol review and approval. So this is going to be going to be discussed by Prof. Fuad tomorrow. But just a brief view, so every proposal that looks on clinical trial has to go through all local ethics committee in UKM, such as UKM Ethical Committee or UKM Animal Ethics Committee. In national level, there are 2 main bodies that looks into clinical research. One is called National Committee for Clinical Research, it's under Kementerian Kesihatan Malaysia, and another one is looking at stem cell related research called ANSET. The approval of research activity must be obtained from the researcher site coordinator. After the ethics is approved, the site coordinators is the research site, the person who actually control the research site must give approval. For example, in HUKM, the body is Sekretariat Penyelidikan dan Inovasi in Fakulti Perubatan UKM. So there's a lot of data flow happening during clinical trial process, but I will not talk about it in detail. Best to just move on to the clinical trial phases that I mentioned just now. So as I mentioned, the three most important clinical trial phase is phase 1 until 3. So you can see that the phases takes months to years to finish. So the first phase might just finish within 6 months to 1 year, and the participant will be very minimal. So in clinical trial phase 1, the experimental treatment is done on a small group of sample, maybe 20 to 80, depends on the sample size calculation and the aim of effect that we want to examine. So usually it judges two things. One is actually the safety effect. And major side effects can be observed already within the first clinical trial, but we also wanted to know what are the suitable drug dosage that will be safe for the subjects that are tested. So the researcher tests an experimental drug or treatment in a small sample and evaluates treatment safety dosage range, and they identify major side effects. The side effect might not be fully understood, fully detected yet at this phase. Or it will move to the next phase, then we will see more of it. So at phase 2, usually runs about 2 to 3 years. The participants are much more larger, maybe 100 to 1,000, and aims to obtain preliminary data on whether the drugs really work in certain population of subjects. For example, for this one, in a type of intervention or drug, we choose a certain group of people or population to test it on. So, and we continue to study the safety, including the short-term side effect that can, which also can last several years. So this study can last from 1 year to several years. So the next one is clinical trial phase 3, where in this phase 3, the approximate length can go way beyond 1 to 2 years. It can go like maybe even 8 years. So number of people enrolled are much higher. They can go from 1,100 to 3,000 people. And the study purpose is looking at, is the drug safe? Again, safety. Number 2 is how effective is the drug on the certain population that we study. So in phase 2, they might actually choose maybe one small population that is quite general, while the phase 3 are testing into a more specific population and a larger amount of sample. And then they will look into whether there is a specific benefit or risk to a specific population. So when we test on different population, we would know that, for example, population A, it is very good, very effective, minimal side effect, while in population B, have similar benefit, but the side effect is more. So this is where we look in clinical trial phase 3. So this is where we identify which population is more suitable and much more safe to receive this medication. So the FDA will approve the experimental drug, and then they will decide whether this drug is good, the outcome is positive, for it to allow the medication to be distributed to the population, the public. So there are many ways of us looking at the clinical trial phases. As you can see here, it starts off not only with clinical trial phase 1. The clinical trials actually starts with preclinical studies. So these preclinical studies is the thing that is founded, or the foundation of the assumptions that the medication might work in human. So before they start this trial in human, there might be a lot of preclinical research done before. So they look at the effect in the laboratory, in animal, before moving on to phase 1, 2, and 3. Okay, so once we see that the drugs is approved for human, you can see that after preclinical study they are approved for human, and then we allow it to proceed with phase 1, 2, and 3 before the medication being approved to be distributed to the public. Once it's distributed to the public, the study still has to go on, where we look into the effect. So people can label it as phase 4, where we look more into what are the side effects that was not noted in phase 2 or for phase 3 before. So this is where the ongoing, chronic, long-term side effect was observed. Okay, so we will make sure that we would not miss anything that can cause harm, and we also guide clinician into making sure that the medication was recommended into correct population. Okay, so the clinical trial phase 4, as I said just now, is to make sure that the drugs and devices takes place looking at effectiveness and safety, again in a diverse population. In stage 3 just now, we may look into 2 or 3 population, but in stage 4, there might be some confounders that happen in this population that may affect the effectiveness or even cause certain safety concerns. So the side effect of drugs may not become clear until more people have taken it over a long period of time. So this clinical trial phase 4 maybe extend years, maybe 5 or 10 years. So the next, so as we understand about the clinical trial just now, we now know that the process takes into making sure that the intervention of drugs that was proposed be implemented to people around the world. There are many steps to it. So, but one of the elements that was mentioned in the first video just now is about randomization. So randomization is one of the ways for us to make sure that the effect is not by chance. So it's a random allocation, the process of selecting entities, for example, what are the treatment regimes that are actually suitable for, and using a formal system that we identify and known to make sure that when we tested the drugs, it's not by chance. It is actually really due to the effectiveness of the drug on that particular disease. So it generally making sure that everybody get equal chance of a response to the treatment. So there are multiple methods or systems in which selection and non-selection is determined by chance alone. But the randomization is the one that controls it to make sure that our result is valid and can be applied onto the population. Randomization is the reliable answer to make sure that there is a reliable answer to research questions. So when we talk about randomization, we usually talk about the process or the type of randomization. And when we tested out a medication, we tested it into a control group, which is a patient who has received standard therapy, and on a tested group, which is the investigational group or the tested group. And sometimes a clinical trial may involve placebo, okay? So this is called a control trial, where you have a control group to compare against your treatment group. Okay? So the objectives of randomization is mainly to avoid bias. Okay, so by distributing the factors that may influence outcome randomly between treatment groups, so that any difference in outcome can be explained only by the treatment alone. So you cannot base your selection by a certain things, for example, based on color or the race. So you want to make sure that your randomization takes into account other confounders. For example, whether the patient is elderly or young, you want to make sure that everybody in this treatment group and the control group are equally distributed in terms of age, gender. If socioeconomic environment is important, then yes, socioeconomic environment needs to be also randomized, factor that needs to be randomized. And we also want to look at whether there are factors that may influence the outcome of the trial. For example, being a menopause can actually affect the influence outcome of treatment of breast cancer. So you want to make sure that your subjects are randomly assigned to the control and the treatment group. Okay, and then that's why there's also an added element where randomization must be hand in hand with something called blinded study. So one of the ways for us to make sure that not only by randomization, we also want to control the bias by making sure that sometimes the researcher may have certain type of bias when examining a certain control group, certain experimental group. Right? For example, an examiner may look into more things they examine the control group, while when they look into the research group or the interventional group, they just might look into it very shallowly, about the effect on the side effect of the medication. So that's why the terms of blinded comes into play. So the randomization sometimes needs to be paired with blinding. So proper randomization will ensure ensures no a priori knowledge of group assignment, making sure there is no allocation concealment. So the patient, the element of blinding the researcher, of subjects, or patients, or participant can add into the value of randomization. So the knowledge of group assignment because the knowledge of group assignment can create a potential selection bias. As I said just now, a researcher who's looking into a control group compared to a treatment group might have a different way of looking at diseases and looking at the side effects and the outcome of the treatment. So we want to blind them from doing it. And there's another way called double blinding, where not only researcher was blinded on what are the treatment given to the patient may also blinded on what they receive for the treatment. So you will eliminate the need of having a placebo for this kind of trial. So outcome of research can be negatively influenced if there is inadequate randomization. So as I said just now, is to make sure that we control bias, and we also want to make sure that the effect was truly because of the medication and not because of other things. So the types of randomization, there are 4 randomization types. One is randomization based on single sequence of random assignments. So this is just simple as flipping a coin, or shuffle a deck of cards, or throwing dice. And a different type of randomization, which is very simple and commonly described in a very small sample, for some very small sample population. So randomization, however, this kind of randomization can cause a problem in a very small, relatively small sample. So sometimes you might end up having, if you, for example, there are 30 subjects that you need, some of them might actually end up to become 20 and 10, because it also depends on the way you flip your coin and certain way of balancing for the simple randomization. So there comes another idea where you can do randomization in block, where you design to randomize a subject into groups that result in equal sample size over time. What we would do is we would predetermine what size of blocks that you have. For example, if you need 60 patients, and you would say that I will put it into 2 or 3 blocks, for example, a block of 20 subjects. So when the patient comes and in the first block, you want to make sure that during this block, this 20 patient that was selected, there are going to be 10 selected for the control group, and another 10 will be selected for the treatment group. So it's best used in smaller increments, as researcher has better control. So for example, if you end up having to stop your study in the middle, you would always have an almost equal number of samples in each group. But blocks are then randomly chosen to be determined the patient's assignment into the group. And however, in block randomization, we cannot control the covariates. So whatever patient who comes, we can just say, okay, this one become this one in group control, and the other one become a tested one. So, and then the next one is, that's why we researchers have evaluated and then come up with another idea of randomization, which is called stratified randomization. So it is used to control and achieve balance among groups in terms of subjects' baseline characteristic, which is other covariates. For example, a patient who has underlying diabetes or hypertension might react differently. So these are the covariates that might happen. So when you use the block randomization, you cannot control it. But if you do stratified randomization, you first identify what are the covariates of these samples, and then decide where to allocate this patient, and then separately, put them into this block. And then this block will then be randomized into these 2 groups. So the subject is identified and assigned to the appropriate block of covariates, and the simple randomization is then performed, meaning that the first thing is to screen the covariates. The next one is you put it into appropriate block, and then there will be a simple randomization that occurs in that particular block to make sure that you do not, you also take into account the covariates to when you want to randomize this patient into control and test group. So there are also something called covariate.
Understanding clinical trial.
Covariate or adaptive randomization. It is suitable for large sample size with multiple covariates. There are many ways to do this. There are also online software that helps you, which is very simple and easy to use. You just must know how to do them, to read the manual, to see how they do it for that particular software. So the methods of randomization is by assessing the imbalance of sample size among the several covariates. For example, if you have a very large subject, you want to make sure that you address all the covariates that can happen in this particular population. So a new participant is sequentially assigned to a particular treatment by considering all the specific covariates and the previous assignments of the participants. So you can actually have a cross group. For example, patients who are in the control group can be then later assigned to the treatment group. So all this cross sampling can be done by this covariate adaptive randomization. So it's usually used in the online, can be adapted into, incorporated into online randomization tool. These are the most common 3 randomization tool that is available in the internet that you can look on. The randomizer.org is something that a software, online software that can be looking into 20 type of treatment plan, and it is not affected by the order in which the treatments are entered or missing data. It is more forgiving. So this randomizer.org. While the other one is called graphpack.com, the maximum treatment plan is only limited at 10 treatment plan. And it's a one-off generation, meaning that once you generate the sampling or the randomization, you cannot reverse it, you cannot recalculate it again. So it is less forgiving compared to the randomizer.org. There's another one called cityrandomization.cancer.gov. This is a US-based software again. Also look into this covariate randomization. So let's go back to the video. Okay, so I think I've covered all the aspects of clinical trials, clinical research, a bit of history, and also the type of randomization. Let's see a video and to understand further how do they describe between block and stratified, and how does this differ. Okay? And sometimes they're going to be incorporated together to make sure that a clinical trial is being done fairly. Okay, so let's go back to this video.
Understanding clinical trials. Clinical trials are research studies that evaluate new ways of improvements and quality for cancer. Clinical trials are an option for all patients and play a role in improving healthcare. Results from clinical trials help new diagnostic tools. Clinical trials also spur new questions for research, and help to better understand. All the drugs and tools we have today were possible because patients volunteered for clinical trials. Every clinical trial has what are called eligibility criteria. For example, a patient may need to have a certain medical condition or gender or other specifics to meet the criteria of participating in the clinical trial. Otherwise, they are not eligible to join that clinical trial and could seek another trial that better fits their situation. Patients who want to volunteer need to understand the potential benefits and risks of participation in a clinical trial. Patients may personally benefit from receiving new therapies or procedures. They receive close supervision from clinical staff. Sometimes the cost of the new drugs or testing is free or waived. Participants may also be part of a research breakthrough that helps thousands of future patients. Patients face the risk that they may not benefit from the new treatment. Additionally, participating in a clinical trial requires commitment. Trials can be lengthy or demanding and may require extra treatments, extra time in the clinic, or tests or costs that are not part of standard care. It is possible, if the study is randomized, that they may be part of the control group that does not.
Okay, are we having some technical difficulties, or are we done with the video?
The notebook habis bateri.
Oh, okay. In the,
I think we are done with the presentation, kan? Okay, I think we can open for question and answer session.
okay, maybe a few questions, because the participants need a break before the session for the afternoon. Maybe if you have any, like, maybe 1 or 2 questions, short question, please put them in the Q&A box.
Belum.
Sekarang saya dah keluar dari Zoom kan?
Masuk balik. Boleh guna notebook sana kot?
Yang ni pun boleh. Ni ada.
Di sana. We are.
Any question from the participants?
Okay.
Okay, while waiting for the participants, maybe they're taking some time to type. Dr. Wan, for the video too, is that a free video that we can access, or?
Yes, it's available in the internet by an institution in the US. I will give the access in onlinelearning.com, so you can actually see the link and you can go to the website. So we will teach more about the type of randomization that's involved. So don't worry about it. I think the video is very simple, it's easy to understand, and I'm sure the participant will benefit from it. Thank you, Dr. Zuri. So any questions so far?
So far, there's no question.
I think there's one by Tan Hui Chen, but I think this one was already it was asked during Dr. Isa Naina's session on how do we randomize in case study. So I already told in my talk just now, I explained about 4 types of randomization. One is a simple randomization, one is block randomization, certified, and a mixture of both, which consider the covariates. So one of the things about deciding what type of randomization is you must first identify how big is the size of your sample in each group. So if the number is about like maybe 40 or 60 in each group, I would suggest a block randomization, which is better, because you would be able to ensure that at a certain timeline, you would achieve almost equal number of subjects in each group. Okay? So block randomization would be suggested in that amount of sample. Yeah.
Okay, thank you, Dr. Wan. If the participants have further questions, how can they address these to you?
Okay, in the first slide, there is my email, so you can contact me there. Thank you for your attendance and attention. I'm really sorry about the technical hiccups. This is the first time I think we play videos online just now, so there were some technical glitches. Thank you, Dr. Zuri.
Thank you, Dr. Wan. Thank you very much.
Goodbye.
Okay,
Have a nice
bye.
day and a nice conference for the next few days. Bye.
Okay, thank you very much. Now I think it's time for a break for the participants before we resume at 2:30 this afternoon. So have a nice break and have a great,
Conference.
have a good the rest of the week, research week, and all the best.
Okay.
And with that, thank you very much. And please visit the chat box for requirements that you need to fulfill, like fill the forms and scan whatever that is needed to be scanned. Okay, thank you very much.
Thank you.